Thanks, Jen. That will help our health and my attentiveness. You may already know about the National Hypertension Control Initiative. Our next speakers will add to your knowledge and share some learnings from the initiative. Joining us from the Health Resources and Services Administration are Ayanna Williams, a public health analyst in the Office of Quality Improvement in the Bureau of Primary Health Care, and Dr. Jeanette Guyton-Krishnan, a public health analyst in the Office of Health Center Investment Oversight, also in the Bureau of Primary Health Care. Ayanna will lead off.
Thank you, John, and thank you for the opportunity to present at today's convening. We are pleased to represent the HRSA National Hypertension Control Initiative team housed in the Bureau of Primary Health Care. Next slide, please. During today's presentation, we will highlight some of the data HRSA has collected surrounding hypertension control, as well as HRSA's current efforts surrounding hypertension control and SMBP through the National Hypertension Control Initiative, which I will refer to as NHCI moving forward. Dr. Jeanette Guyton-Krishnan and I will discuss common challenges and successes health centers have experienced to date, as well as pose a few action items and opportunities for you to join us in supporting SMBP implementation. Next slide, please. I'd like to start by sharing a bit about HRSA. HRSA Health Center program provides care through nearly 1,400 health centers who operate in more than 13,500 service delivery sites. In 2020 alone, HRSA-funded health centers served nearly 29 million patients, and 5 million of those patients were diagnosed with hypertension. Health centers provide patient-centered, comprehensive, integrated care by offering a range of services, which include primary medical, oral, and mental health services, to substance use disorder and medication-assisted treatment services, all the way to outreach, case management, health education, interpretive services, and transportation. Next slide, please. So I'd like to start our conversation about SMBP by highlighting the data HRSA collects through the annual Uniform Data System. HRSA health centers and lookalikes have shown drastic improvement in high blood pressure control over the past 4 to 5 years, really. The national average for control of high blood pressure increased 2.3 percentage points between 2016 to 2019. And as you'll note on the slide, between 2019 and 2020, a time period that we'll all know marks the impact of the COVID-19 pandemic. During that time, health centers decreased in terms of hypertension control. This is a trend we saw across most UDS measures. And I want to note that in most years since 2016, 100% of health centers have served hypertensive patients, with a few exceptions of health centers that were just ramping up. And this is important to note because it highlights the huge potential that HRSA-funded health centers have in combating hypertension in the United States. I'll note that during this 5-year period, the number of hypertensive patients served by HRSA health centers increased by 1.1 million patients. Of note, between 2018 and 2021, the Million Hearts Initiative has continued to recognize clinicians, practices, and health centers, health systems, including health centers, that demonstrate excellence in hypertension control. And we are proud that in each of these years, HRSA-funded health centers have been highlighted as both champions and exemplars because of their great work. Next slide, please. A bit more data, but this time looking specifically at race and ethnicity trends. So when reviewing that same 5-year period, you'll see that hypertension control by race and ethnicity reveals that patients of Asian descent and white patients, both Hispanic and non-Hispanic, experience an increase in hypertension control rates, in particular an increase that was higher than the national average, which is indicated by that gray dotted line in the middle of the screen. And just below that dotted line, you'll see two lines which showcase that Black and African American and American Indian and Alaska Native populations, while they also experience for the most part an increase in hypertension control rates, they remained below the national average. So it's important to note that this chart displays that overall, all ethnic and racial groups experienced a reduction in hypertension control between 2019 and 2020. Again, that time period marked by the pandemic. So while this information is helpful in tracking trends of high blood pressure control over time, and we look forward to continuing to see with the 2021 and eventually 2022 data, note, we do recognize that more data is needed to understand not only how screening and treatment for chronic conditions impacts these patient outcomes, but also the impact of SMBP. Next slide, please. So with that, I want to begin to talk about the NHCI. In 2021, HRSA awarded nearly $90 million in funding to 496 health centers across the United States. You can see a list of all of these health centers on the NHCI Technical Assistance webpage at the HRSA website. Next slide, please. In order to receive this supplemental funding, health centers had to apply and agree that they would follow the following four requirements. The first is that they would conduct outreach and engage with patients with uncontrolled hypertension through this initiative. The second is that they would fully participate in training and technical assistance activities offered through this initiative. The third is that they would ensure access to and support of Bluetooth or wireless enabled SMBP devices or blood pressure cuffs for a majority of their patients with hypertension, and that they would use that data to inform their hypertension treatment plans. And lastly, NHCI supplemental funding awardees agreed to collect and share data to support their participation in this initiative that will help us with evaluation and reporting. Now I will pass it over to my colleague to share more about the challenges and successes that we've learned in the past year and a half. Next slide, please.
Thank you, Ayanna. The trends that Ayanna just showed you are why NHCI supplemental funding to health centers is important. We know from the evidence that SMBP is an effective and convenient approach to screen for hypertension, and it is proven that when combined with additional clinical support, SMBP is effective in reducing hypertension, among other benefits. This is great news, but we know that in practice or during implementation, the unexpected or unanticipated does happen. And that has been the case with the barriers and challenges our health centers have shared with us so far. And so I will walk us through some of them and provide a bit more detail about what the specific issues are. And then at the end of my portion, end it with some successes, because there are some good things happening as well. All of the information I will share comes from the Health Center's semi-annual progress reports for the period ending December 2021. Next slide, please. Next slide, please. Okay. So let's start with accessibility challenges. Our health centers have reported issues related to difficulty finding affordable and appropriately sized blood pressure cuffs. Many hypertensive patients are larger or obese and require an extra or extra large cuff, and many vendors do not offer cuffs that are large enough. In some cases, for data validation, the device the health centers find works best with their EHR system isn't on the list of validated devices. Also, procuring Bluetooth or wireless-enabled SMBP devices for patients has also been a challenge due to supply chain issues and a global workforce affected by the pandemic, as well as low inventory by some vendors. And finally, the costs for devices are much higher than anticipated. The current average cost of wireless SMBP devices is 25 to 40% higher than pre-pandemic, primarily due to those device supply chain issues. Next slide, please. Next are technological challenges, specifically low access to smartphones or apps, as well as inconsistent and low access to Wi-Fi and/or cellular connectivity. There is poor or inconsistent compatibility between SMPP devices, EHRs, and patient portals that prevent the fluid transmission of BP data. And finally, there are difficulties integrating BP measurements from the SMBP device into EHR platforms. Some EHR integration solutions use third-party vendors or apps, and some of our health centers are using a loaner program to reduce the number of devices purchased, but some vendors or apps don't support device reassignment for loaner programs, and so integrating new sets of data are problematic. Next slide, please. Next are staffing challenges. Some health centers are reporting problems with recruitment of staff or high staff turnover to facilitate implementation of the NHCI program. In some cases, there is a lack of provider and patient education and training on the utilization of the SMBP device, either because there is a lack of staff or that particular staff is off or unavailable. And then there are competing priorities for the staff that are available. While perhaps not so much now, but for a time, COVID-19 testing and vaccinations were priorities, and so the focus of the staff had to shift. Next slide, please. For patient challenges, in some cases, there is low literacy about technology or minimal experience and/or low patient confidence in their ability to successfully operate a wireless SMBP device. There is also a need to provide instructions for SMBP device usage and app translation beyond English and Spanish. We know that 24% of health center patients are best served in a language other than English, so having access to SMBP device materials in appropriate languages and ensuring patients have access to materials while at home have been challenging. And finally, pandemic impacts on health centers, patients, and communities have resulted in limited preventative care visits. This is particularly important for training patients on SMBP device usage when patients are overall attending fewer in-person appointments. Next slide, please. So those were some of the challenges, but that's certainly not the full picture. Health centers have reported some successes as well, and these include several that have actively recruited and hired community health workers whose main focus is to enroll patients in the NHCI program, and once enrolled, patients are provided access to SMBP devices and training. Now that in-person visits are returning, health centers are offering in-person training appointments for device setup. After that initial appointment, follow-up calls are made to patients to troubleshoot the device if problems persist, and staff use that time also to support or reinforce healthy behaviors. Some health centers have stated that the training of patients on the use of SMBP devices has resulted in increased one-on-one patient engagement, even during virtual visits. SMBP data are being utilized to develop benchmarks and achievable treatment plans to help patients develop and maintain healthy lifestyle choices. And finally, some health centers have incorporated a teams-based approach to pair clinical pharmacists with nursing teams to help improve patient education and medication adherence as part of the patient's individualized treatment plan. And so in closing, the successes and challenges from our health centers have allowed us at HRSA to develop a very targeted technical assistance strategy that addresses these very issues and supports our health centers with overcoming them, with the goal of moving the needle in a positive direction to address hypertension control with their patients. And now I'll turn the presentation back over to Ayanna.
Thank you, Jeanette. So now that we shared the lessons learned from health centers and the NHCI, I want to end our presentation with a few action items and areas for collaboration. The first are grant-making opportunities in support for SNB implementation. We hope that, similar to the NHCI supplemental funding that HRSA has invested, we implore you to create or continue to create funding opportunities to support not only health centers, but other health systems and healthcare entities to purchase SNBP devices, associated apps, or to help make that transfer of information between EHR vendors and the devices themselves. We also hope that you'll support the technology and integration of SNPP data into the electronic health record, whether that be through technical assistance opportunities for staff or by helping to partner between companies and healthcare entities to help exchange information needed. Thirdly, we hope that you will continue to acknowledge and affirm healthcare staff as they are dealing with limited staffing and high staff turnover, and acknowledge the role that this plays in SNBP implementation and supporting them throughout this effort. We'll add that at HRSA, we know that in 2020 alone, 24% of patients were best served in a language other than English. So we hope that you will join us in helping to create and translate patient education materials, both for SNBP devices, SNBP protocols, as well as patient education materials into languages other than English and Spanish. We also hope that you'll continue to support and innovate ways to make SNBP devices more affordable, whether that be supporting health centers through funding or helping to make connections when there can be relationships made for more affordable options for our healthcare entities and their patients. Lastly, we hope that you can help us to find innovative ways to address the ongoing challenges and barriers to remote patient monitoring and SNBP implementation that we've mentioned to date, whether those are ideas that we have not proposed today or additional solutions that you come up with. Next slide, please. Again, we want to thank you for the opportunity to present, and we look forward to hearing your updates on what you're doing surrounding SNBP. Next slide, please. We hope that you will partner with HRSA in a variety of ways to support hypertension control across the United States, especially in using SNBP in this effort. Thank you.